Hello, everyone. It's Monday, December the 28th. I hope and pray that all of you had as merry a Christmas as you could possibly have had. I surely know that your prayers for all those that we've lost in the state of West Virginia have been greatly appreciated. And today we only have 17 additional deaths for me to read through, but don't let this deceive you, because probably over Christmas we've not had some reportings that have failed to come into us, and so with those reportings that we don't have, this number is probably significantly higher than the 17. 17 is way, way, way too many, but if I could, with all due respect, read through these, I'll surely do that right now. Our 1,247th death is a 70-year-old female from Jefferson County. Our 1,248th death, a 68-year-old female from Cabell County. Our 1,249th death, a 91-year-old male from Cabell County. Our 1,250th death is an 87-year-old male from Cabell County. Our 1,251st death is a 66-year-old female from Cabell County. Our 1,252nd death is a 63-year-old male from Jefferson County. Our 1,253rd death is a 77-year-old female from Preston County. Our 1,254th death, a 90-year-old female from Kanawha County. Our 1,255th death, an 80-year-old male from Hampshire County. Our 1,256th death, a 92-year-old male from Cabell County. Our 1,257th death, an 85-year-old male from Monongahela County. Our 1,258th death, an 89-year-old female from Greenbrier County. Our 1,259th death, a 45-year-old male from Kanawha County. Our 1,260th death, a 99-year-old female from Cabell County. Our 1,261st death, an 82-year-old female from Kanawha County. Our 1,262nd death, an 80-year-old male from Cabell County, rather. I'm going to read that again. Our 1,262nd death, an 80-year-old male from Cabell County. Our 1,263rd death, a 94-year-old male from Hampshire County. That totals 1,263 great West Virginians we've lost. You know, in addition to losing these great people that I call every day and go through the stuff, you know, from male, female, counties all across our state, their age, it rings everywhere, and I hope and pray you'll have many, many prayers for them. But in addition to this, you know, we have now had another level of catastrophe that's happened within West Virginia. We lost a National Guard senior airman. His name is Logan Young. Logan is 30 years old. He's a firefighter for the 167th Wing in Martinsburg. And the way this all works and everything, we, you know, I guess contract or have relationships with counties and whatever like that, where our Guard firefighters go and help and assist in you know, fire emergencies that we have. Well, over this Christmas time, Logan answered a call, like Logan has done since 2018 when he joined the Guard. You know, he was a combat veteran that was previously deployed to the Middle East, a resident of Martinsburg, and survived by his mom and dad, a brother, and a fiance. A fiance that is having a little baby, but in not very long. And Logan and this beautiful girl have been together a long time. I talked to his dad yesterday, and his dad talked about that they had been planning and been together for 6 years, and they've been planning so many things for their life ahead. Well, Logan, in this fire that he responded to, and from what I understand, it was a fire at a barn, and in responding to this fire, a beam fell on Logan and killed him. The tragedy beyond belief in this is the state fire marshal's office has determined the cause of the fire to be arson and continues to investigate with the help of the West Virginia State Police, and is asking all of us that if you have any information, please call the state fire marshal's office or the state police. There's a reward of $5,000 that's been posted. You know, again, it's just terrible. It's just plain terrible. You know, I've said this many times. We cannot let these people, or we cannot let Logan and his family go unnoticed, and we cannot let them feel alone. No, we can't do it. We can't think about them for just today and forget about them, you know, in weeks and weeks to come. We can't do that. We've got to know, and they've got to know, that we'll be here. We'll be here. And we'll be here on our watch trying to help them in any way we possibly can. You know, what an incredible young man that served our nation. And really, I've said it over and over and over, and isn't it ever so true, that especially our military, we owe everything we have to them, do we not? Do we not? Is it not just that simple? Really and truly. Look across the globe at all the other countries. Think about what we have in this country. Who do we owe it to? We owe it to our military. We owe it to Logan. And we owe it to his family. And we owe it to his little baby-to-be and his fiancée. We owe them. And we shouldn't forget it. In regard to our numbers, you know, our testing is somewhat skewed and everything because of the number of tests we did and all this kind of stuff over the holiday and all that. But the net of the whole thing is just this. You know, our cumulative positives now is at 4.66, so it continues to go up. Our total active cases are a little over 24,000. We're right at 56,000 people that have recovered. The number of people hospitalized are 720. That's up a little bit. 200 patients in the ICU unit. Yesterday, we only tested 4,000, a little better than 4,000 people in West Virginia. And you know there's days when we've been testing 12 and 14,000. So those numbers, like I said, are a little skewed because of that. Our RT number is at 1.13. We're the second worst in the whole country. You know, the number of orange counties and red counties, we now have 52 that are in the orange and the red. You know, there's no question that we have a real live problem in West Virginia, do we not? But the problem is everywhere. The problem is all across America. And even as tough as this problem is in West Virginia, it's only a fraction of what it is across America. Now, there's no question that we're in for good days ahead, and we're in for some tough days ahead. Let me just tell you, just as point blank as I can possibly tell you, every single person that would get vaccinated, every single person that has the vaccine will help and help and help. The more we vaccinate, the faster we're going to get well. The faster we're going to stop this thing. You know, the more we wear our mask and protect ourselves, the faster we're going to stop it. If you want this thing to absolutely get like a horror film, all we've got to do is stop wearing our mask and just sit on the sidelines and wait for it all to happen. This thing's not going to go away. Science, all of our work, and the good Lord above are going to make it go away. Now, when it's your time to get vaccinated, you've got to run to the fire. Absolutely, if you're over 65 years of age and you get a sniffle, you have got to immediately run to the fire and get a test. If you get a test and we catch this within the first few days, we'll give you antibodies that will absolutely, probably, in every way, make you well. If you don't, you got a high chance of dying. It's just that simple. If you're in excess of 65 years of age and you let this thing go and think I've just got a headache or I've just got the flu or I've just got a sniffle or whatever it may be, you know, I'm just really tired, but I've been working real hard and everything, and maybe I didn't sleep good last night, and you just let it go and you just put it off, and you put it off long enough, 6 or 7 days from when it started, there's not much that these antibodies will do to help you. And then you're going to be fighting for your life, trying to figure out how to breathe, how to just breathe. You're not going to be able to have your loved ones at your side. You're going to be fighting for your life and trying to figure out how to breathe. So if you get the least bit sick and you're 65 years of age, you feel the least bit different, please go get a test. We're offering free testing all over the place. It may be a little inconvenient, but it may very well save your life. So with that, you know, I've had the vaccine now for a couple of weeks and feel great, no issue whatsoever there. There have been 30,737 doses administered in West Virginia. We're still leading the nation in distribution and administration. That's really good. And we owe so much to our health officials and the National Guard there. That's really, really, really good. You know, we're at 50.49% of the total number of doses that have been given to West Virginia that have been stuck in somebody's arm. The total doses that we have of vaccine in West Virginia right now are 60,875, and we're pushing it out the door just as fast as we possibly can. Get absolutely vaccinated. That's all there is to it. It's just as simple as that. The closest state to our 50.49%, the closest state to us as far as getting it done and getting it done fast is Maine, and they're at 37%. They're so far behind we can't even see them back there, and that's just how good a job the National Guard and our health officials are doing. We're expecting to receive a Moderna shipment today in 4 of our 5 hub locations. We expect Pfizer product today or tomorrow as well. In total, we will be receiving 25,925 doses this week, you know, and it just goes on and on. You know, we move towards vaccinating the people that are, you know, not only the nursing home, the elderly and all that. We want to stay right on top of every bit of that, all of our health community and first responders and everything, but we're also vaccinating those that are giving us the shots and absolutely vaccinating the vaccinators, you know. And so as we go forward, we can be assured that the network that we have in place to be able to take care of you and take care of our government, take care of our hospitals and everything, those people will be protected and be there for you when we got a problem. West Virginia is also leading the nation in distributing COVID-19 vaccines to our nursing homes and assisted living. We took a slightly different approach, you know, than most of the states, you know, went through, and we're very, very hopeful to complete the first doses within the first month of when we've gotten them. One of our priorities was always led with going back to April when we focused on testing in long-term care facilities is taking care of the most vulnerable first. We are making significant progress in our plan to offer vaccination to all long-term care facility residents and staff, and should be complete with all 214 facilities in the state today. It's amazing. This is far ahead of anybody else in the nation. That's 100% of our long-term care facilities that we will have offered vaccine to in our state, and before some other states have even gotten started. So the bottom line is this: we're hopeful today to have all 214 of our facilities within our state that we have offered vaccine up to. That's our nursing homes and long-term care facilities. Now, the really important and if not, that's amazing. But even more impactful is just this. The amount of people that we have in West Virginia in our nursing homes and assisted living in comparison to other states maybe like Texas or whatever, are twice as many. Not twice as many total people, but percentage-wise, twice as many people are in our nursing homes and assisted living than in a place like Texas. And so we're doing an unbelievable job. And again, take your hats off to the health officials, the National Guard, all the great stuff that they're doing. I remind you real quickly again that the vaccine, you're not going to get COVID from the vaccine. Pfizer and Moderna are saying over and over and over just how safe these vaccines are. And the other thing I would tell you is just this. There's a lot of people that are out there in the network that are coming up with additional vaccines. The problem with some of those additional vaccines is where Pfizer and Moderna's, rate of prevention and everything is like 95%, equivalent to taking a smallpox vaccine. Their rate of success is 95%. Some of the other vaccines are falling in at 70. So when the Pfizer and Moderna vaccines are offered to you, you got to take them. You got to really take advantage of that. And the faster we get them gone in somebody's arm, the more we'll get. It's just as simple as that. If we kind of sputter along and we really don't, we got plenty in stock, you can bet the federal government's going to say, well, there's no point in sending more to West Virginia today. We've got a crisis over in Los Angeles or whatever. We'll send more to Los Angeles. Well, we want absolutely to get all of you vaccinated. From a standpoint of our antibodies and so on like that, now think about this. This is what I'm talking about. If you especially are 65, but you don't have to be 65. You could be whatever age. But if you get this and we catch it really early, right now in West Virginia, we have 1,400 of these doses that are out there all over the place that you can get. And in addition to that, we've got 600 more that are supposed to arrive right immediately. And we're trying to get this into people's hands, not only in the hospitals, but in the people's hands that are really close to you, at the nursing homes, at the assisted living, at the pharmacies, or wherever, where you can get these drugs through your doctor and get these drugs very quickly, and because hours really mean something, not just days. I've talked to you a whole lot about getting tested. You got to continue to get tested. Here's all the free testing stuff. It ought to be up on the website. The drive-through pharmacy stuff. We really, really appreciate all these great people and all the work they've done. Our school outbreaks, we have 9 active outbreaks now and 35 total cases in our school system. Of course, the obvious is a lot of places we're not going to school in West Virginia. But still, what an incredible job's been done right there, and the schools have been a safe haven. Our long-term care facilities, we have 113 outbreaks. We have 16 outbreaks in 14 counties in our churches, and those counties are Greenbrier, Harrison, Jackson, Lewis, Marion, McDowell, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Summers, Webster, and Wyoming counties. We go over and over the same thing. If it saves one life, I say it 1,000 times. What is a life worth? Nobody can tell him. Nobody. If it saves one life and one person listens, if you go to church, keep a pew in between you and others. Keep social distancing between you other than somebody that's in your immediate home. Now, other than that, wear your mask at the church the whole time and wash your hands. But if you're 65 and older, I would highly, highly encourage you to just take a few weeks off from church, get your services online, in some way, somehow, buy some time to get to the point in time when we can vaccinate you. From the standpoint of corrections, we have 488 now. We've bumped up big time. As far as active inmate cases, we have bumped, and it's just as typical as it always is. Once it gets somewhere, this thing grabs us, doesn't it? We have 285 now at St. Mary's. We have 77 at our Eastern Regional Jail, 55 at our Central Regional Jail, and 50 at Tigard Valley, and there are 49 staff cases statewide. We have begun a new, additional 25% testing of all of our staff at corrections every week. These people have done an amazing work as well. As far as wearing your face covering and so on like that, that's an executive order. It's mandated. I really commend you, because across West Virginia, we're probably at 97% of people that are going in public buildings or whatever are going with a mask. Well, to be perfectly honest, when we started this thing, Dr. Marsh would have been jumping through hoops and everything and really happy about that. But if we can get 97, why can't we get 100? When it really boils right down to it, we have some people, some folks that are still probably hung up on whatever principles it may be, but I keep going back to the same thing. If I don't believe in these masks, I don't think they work, and, I don't believe that somebody ought to mandate for me to wear them. Let me just make it real simple. I don't believe in it, and I don't think it's right. Please tell me one thing. What does it hurt to do it? What does it hurt? What if it didn't do anything to make things better? And surely, to goodness, it doesn't have really anything to do with your rights or taking away your guns or taking away something. What does it hurt? What does it hurt to wear this mask? And I'll promise you this, if you think just what I just said, that it doesn't do any good and that it's your right, you're thinking wrong. That's all there is to it. You don't have a right to drive drunk just because that's what you want to do. We are a nation of laws. We are not going to take away your rights. We're not going to shut down the whole world. We're not going to take your guns. This isn't the first stepping stone to something that's really bad, but within all of me, I tell you just what has been told to me over and over. You can't imagine how many people that have said, by God, I ain't wearing that mask. That's my right. I'm not wearing that mask. And the next go round, probably, 3 weeks later, I hear Charlie is sick. Charlie's got COVID. And the next thing I hear is a message from one of his loved ones that says, will you please tell the people I was wrong? Will you please tell the people me not wearing a mask was all wrong? This stuff is not the flu. This is the worst thing I've ever been through in my life. And then in most cases, the next thing we hear is sad singing and slow walking because Charlie's no longer with us. So, wear your mask. Get your flu vaccine. Give blood and plasma especially if you've had this. We need the blood, that's for sure. Red Cross is fabulous at work. Last night, our president signed the COVID relief bill, the stimulus package, and I'll just outline just a little bit about this real quickly, but the net of the whole thing is just this. you know, there's no point in me saying anything but this, but for D.C. and these people, you know, our senators, our congresspeople, and everything that are all across our land in D.C., don't you just think that we cannot do better? We cannot do better than what we're doing? Not to slight the people as not being good people, but why in the world have we had so many people hurting for so long? Why in the world now do we come up with a bill that's passed that should have been passed forever ago? And why in it do we have all kinds of stuff that has nothing to do with COVID, but is just stuffed in there the back door so we can get something and somebody else can get something else and somebody can get something and this and that? Political. Thank goodness we've passed something. We got too many people and too many businesses that are really hurting. What they did in it is just this. They extended the CARES money deadline, and we'll have to pivot now. We had all set for how we were going to bucket every single dime of that CARES money, and it was all working. Now what we should do is we should pivot again, because we've got deep dive money where we're paying ourselves back and everything. We've got ways and everything now to look at doing additional things going forward, and so we pivot again. Rules have changed, and you pivot again. As far as the direct payments, they're going to make $600 direct payments to individuals that are making below $75,000 a year, and $1,200 for couples that are making below $150,000 a year, plus an additional $600 per child. So really and truly, the way it boils down and everything, if you're a couple making $150,000 or less, you're going to get $1,200. And the way I read it, you're going to get another $600 for every child. Now that's just a subsidy payment directly to the people. You know, there's going to be an enhanced unemployment benefits of $300 a week. You know, that's going to be extended for 11 more weeks, and that is in addition to what you receive in your unemployment check. There's $319 billion for small businesses, including $284 billion that's going to go back to the PPP program. Now, the PPP program was just this, and the way I'm sure this works and everything now is people that signed up for the payroll protection program, the way that happened, it was all devised to help you pay your labor and to get you through this time frame. The way I think it's going to work is going to work just like this. Let's just say you are restaurant ABC, okay? You had a payroll. At one time and everything, your expected payroll was, pick a number, $100,000 a month, or your annualized payroll, was $100,000 in a year. Okay, so what you would do then is you would multiply that, in some cases by 3.5 times, but in most cases by 3 times, and you would receive dollars 3 times that your annual payroll, your annualized payroll, 3 times $100,000 or $300,000. And what you are then to do with that money is pay your people, pay that money and for their benefits and their labor, pay that money out that way. So it was a direct payment, and it was to be forgiven. Up to a certain amount, it was to be forgiven. And so I'm sure all across West Virginia, we had businesses after businesses after businesses apply, and what I am telling you right now is if by chance you were one of those that fell through the cracks and didn't apply, well, for God's sakes, apply. You know, it may very well not work, but it may very well work. And every dollar that we can bring into this state is a dollar that's going to help our economy in every way. Apply. Now, if you had applied before, go back now and reapply again, because that's exactly what these dollars are for. Exactly what these dollars are for. Now, from a standpoint, there's going to be $25 billion in rental assistance with an extension of the eviction moratorium. There's going to be $82 billion for schools and universities, with $10 billion dedicated to child care. $7 billion for increased access to broadband, and additional funding to facilitate the vaccine distribution. I've not seen all the 2,000 pages. My people haven't been through the 2,000 plus pages of what this all is and everything, but that's pretty much a breakdown. And so I'll go through that really quick one more time and everything. You know, there's an extension to the existing CARES funding for a year, you know, for our state and local governments. There is, you know, a direct payment to all individuals for $600 one time. The people that are making $75,000 and less. If you're a couple and you make $150,000 or less, it's $1,200. Plus, you get an additional $600 per child. You know, there is enhanced unemployment benefits. So if you're getting unemployment benefits now, you got 11 additional weeks of an additional $300 a week, plus your unemployment check. You know, our small businesses, there's $319 billion. Of course, nobody can understand the magnitude of that money. I couldn't begin to understand it. You know, just imagine that $1 million is all the money in the world. $1 billion is 1,000 millions. 1,000 millions. And so there's 318,000 millions here that's going to go out to our small businesses, and that's for the Paycheck Protection Program, so apply. There's 15 million that's going in rental assistance, and the extension on eviction is the eviction moratorium has been extended. There's $82 billion that's going to schools and universities. $10 billion is going to be dedicated to child care. $7 billion is for increased access to broadband, and there's going to be and the funding will be there for the vaccine distribution. Scott Adkins with Workforce is with us today, and he wants to talk to you about the unemployment benefits, and that's all I've got, so I'll turn it over to Scott.
All right, thank you, Governor. Next, we'll go to Scott Adkins, Director of Workforce West Virginia.
Good morning, and thank you, Governor Justice. As Governor Justice said, President Trump signed the new COVID relief bill last night, extending some of the unemployment provisions of the CARES Act. And I'm going to go through those pretty quickly. There's three major components that affect lots of West Virginians. Keep in mind, Workforce is still waiting on guidance from USDOL on how exactly these programs will look. But I at least want to give you the framework of what those extensions will entail. First of all, the Pandemic Unemployment Compensation, or PEUC. Initially, folks were eligible for up to 13 weeks. That expired this past Saturday. The extension that President Trump signed will provide an additional 11 weeks for a maximum of 24 weeks. PEUC will be available starting this week and ending the week of March the 13th. If you're eligible if you were on PEUC or you were receiving EB or extended benefits, you don't need to do anything at all. Workforce will start making those payments. Once the guidance is in place from USDOL, we'll come back on and share additional information with you, but just continue to do your weekly certifications as you normally do. The second program, and Governor Justice alluded to it briefly, is the Federal Pandemic Unemployment Compensation, or FPUC. Many of you remember that folks were eligible for an extra $600 a week between the weeks of March the 29th and July 25th. Under the extension program of the CARES Act, you're going to be eligible for an additional 11 weeks of $300 per week. And so the $300 will be on top of what your normal weekly benefit amount is. So if you're receiving regular UI, and your maximum weekly benefit is $424, you'll receive the $424 plus the $300. Now, keep in mind, you have to be eligible for some form of unemployment to be eligible for the $300. So it can be regular state unemployment, it could be PUA, it could be one of the trade programs, but you have to be receiving some sort of unemployment to be eligible for the 11 weeks of $300 per week. Just like PEUC, that program will end March the 13th as well. And the last program I'll mention is the Pandemic Unemployment Assistance Program. And again, that's for independent contractors, self-employed folks. Originally, you're entitled to up to 39 weeks of benefits. Many of the folks who are eligible for PUA exhausted their benefits late November or early December. Starting this week, you're going to be eligible for an additional 11 weeks of whatever your weekly benefit amount was for PUA. You'll receive that moving forward. In addition to that, you also receive the FPUC payment of $300. And so just to make sure everybody understands, if your benefits have exhausted, you don't need to do anything at all other than continue to file your weekly certifications on Sunday. Workforce will send those payments to you once we get guidance from USDOL. Thank you. And if you have any questions, feel free to call 1-800-252-JOBS, and we'll try to answer those questions for you. Thanks, Jordan.
All right, thank you, Director. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good morning. I just want to reinforce what Governor Justice brought out to us regarding Senior Airman Logan Young. Logan was responding to a fire as part of our mutual aid agreement that we have with the counties. Logan spent a number of years on active duty, as the governor pointed out, deployed overseas, and as his father told us last night in the conversation, came back to the Guard specifically to be a firefighter. And his dad told us that that was what he always wanted to be in life. So he was doing what he loved to do. He epitomized what our guardsmen and our first responders epitomize, and that is selfless service and dedication to our families and our communities to make the world a better place. On behalf of all the 6,400 men and women of the National Guard and our families, to his dad, Steve, his mom, Beth, his brother, Nathan, and his fiance, London, we send out our prayers, our thoughts, and our deepest condolences. We will be with you from here forward, and you will always be a part of our West Virginia National Guard family. So God bless the Young family and Logan and his sacrifice and service to our state and our nation. Related to our vaccine distribution, as the governor pointed out, we are moving rapidly forward towards completion of our long-term care facilities, and we hope that those will be finished today. If not today, by the next couple of days. We have last week, or this current week, distributed 35,000 plus vaccines last week as part of our effort. We continue to process vaccines out for distribution today and are preparing for new shipments to come in this week. Spent a lot of effort this past weekend with senior leadership working on strategic planning and preparing things for the governor to review for final execution, as well as working with DHHR and others to set up the appropriate infrastructure that we need going forward, not just for the distribution and administration of the vaccine, but for the general population for scheduling going forward as we get into these next groups. We appreciate all the effort and hard work of all the various organizations supporting the GIADF, and the governor and I and the COVID leadership team greatly appreciate the work that's being done. Thank you.
All right, thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's great to be with you. I also want to reinforce what the governor and General Hoyer have said. I think that the fact that we are almost finished with the first vaccinations of our long-term care facilities is really a singular achievement that we should be really proud of. Ultimately, that's certainly not the end of what we need to do for certain, but the fact that we have really operated like a single team, as the governor said, we've all pulled the rope in the same direction. We certainly want to give a lot of credit to Marty Wright, who is the lead of the Long-Term Care Association and all the leadership for the long-term care facilities, as well as the great relationships that we have as our interagency task forces with the GARD and DHHR, the pharmacies, the facilities. It really is a great accomplishment when you recognize that 47% or so of our deaths come from the long-term care facilities. And as we look at risk of dying from COVID, we know that our over 70-year-olds make up about 77.5% of the age ranges of people who've died from COVID in West Virginia. And people 75 to 85 years old and above have a 220 to 630 times risk of dying from COVID-19 as compared to a healthy age group, the 18 to 39-year-old group. And so as we start to look at what we're doing, we really are meeting the governor's commitment to the state of saving lives and reducing the severity of illness in people who will take up beds in our acute care hospitals. So very well done. Right now, we are really focusing on the next stage of our vaccination plan, as the general indicated. We're starting to look at moving from places where we have centralized populations like hospitals and nursing homes, long-term care facilities that have an infrastructure, have medically trained personnel, to getting to other people in our critical workforce sectors and other healthcare sectors as like home health and hospice and people that work in different parts of this healthcare industry, looking at an older part of these workforce populations of over 50 years old, and then quickly, as the governor has instructed us to do, to move toward the most vulnerable parts of our population, the over 80-year-olds, the over 70-year-olds, the over 60-year-olds that make up 92% of that group of people age-wise who have died in West Virginia. So certainly getting to that population quickly is important. And to do that, we have to have a different set of capabilities, a set of capabilities that has a footprint in every community, in every place. And what we're doing now, as the governor said, is vaccinating the vaccinators. We're looking at the FQHCs, federally qualified health centers, that serve almost 500,000 West Virginians as far as primary care, and rural clinics and hospital-associated clinics and other assets that we can put vaccines in the communities really close to people who are in these other sectors in a more decentralized ways and way. And as we do this effectively, then we will be able to reach each West Virginian at their front door so that we can provide them this vital, life-sustaining and protective intervention, the vaccine. And as the governor said, all of us have taken the vaccine, and I would say for me, I have no effects at all. I've taken it, my arm's not sore at all. And I want to make sure that people recognize that ultimately vaccines in people's arms is what we're really trying to do, vaccinations. And for each person, when it's your time, you can't get the virus from the vaccine. The vaccine is incredibly protective, and we absolutely encourage and implore each West Virginian to do this. And we want to make sure that we're doing this as a state so that we can stop the spread of COVID-19 and get back to the activities that we want to do. But in the meantime, it is really important that each person take the appropriate precautions with mask wearing and physical distancing, because we also know that this holiday season, the Christmas holiday, the Kwanzaa holiday, the New Year's holiday coming up, is a time of particular risk. And the new incoming head of the Centers for Disease Control is predicting that January, toward the end of January, is going to be the most challenging time that we've seen in the U.S. But as West Virginians, let's demonstrate the leadership that you have done to date amazingly, and let's be the place that starts to stop that spread, both by getting vaccinated and also by doing the appropriate mask wearing, physical distancing, staying at home as much as possible during this really critical time. Thank you.
Thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just want to reiterate that, as the holidays are approaching, we just finished the holiday season of Christmas, which is a good time to be with family and friends. And as New Year's is approaching about three days from now, that we do want to spend time with family, but we do want to remind everyone that if you're going to celebrate with family members or friends that aren't living in your household, that it is a time that we can see an increase in COVID-19 cases. So if you can spend that time doing some virtual or other ways to celebrate, because we are going to see an increase in cases across the state as well across the country. So you can check in with them virtually. We do remind people that it is a time where people are isolated and may feel lonely, but we do want to increase that awareness across the state as well. But if you are going to celebrate, to remind yourselves to wear masks and to stay socially distant as much as possible. We do want you to enjoy the holidays as safely as possible. There are ways to do that online. We have ways on our DHHR website as well as CDC to celebrate the holidays safely. Thank you.
All right, thank you, Dr. Amjad. Bill Crouch, Secretary of the West Virginia DHHR, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. And Governor, I'm going to direct this to you. I'm just trying to get some clarity. Is there specific money set aside in this latest CARES Act that the president signed last night for reimbursement for state and local governments in addition to what we've already had?
I don't think so, Mark. I don't think so at all. And the reason, I think what you're going to see is that's what, our Speaker Pelosi has pushed, and from the Democrat side, that's what they continue to push. And really and truly, what this came down to make it really simple, is just this: the Republicans were really pushing hard for some kind of limited liability in regard to exposure. If you were at a restaurant and you picked up COVID at the restaurant, that you couldn't turn around and sue the restaurant owner. The Republicans were pushing for that. The Democrats were pushing for basically an avalanche of money to go back and backfill cities and counties and pension plans and stuff like that have happened, decades ago, and try to make up for sins that were decades old. And so that was the battleground there. And basically what finally got done is they removed those from the table at this point in time. They pushed out the door what I just said. I don't think there's any backfilling to cities and counties right now at all and everything, but that doesn't mean that's not going to come back up and everything. But for right now, that's not in the bill. That's not in the stimulus package.
All right, thanks, Mark. Next is Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. This is sort of in relation to the question I asked last Wednesday. Has there been any talk about trying, and I know that, we only have X amount of vaccines, and I know we keep getting more each week. I know AstraZeneca, which, full disclosure, I'm on the trial. I know they're looking at getting into the mix maybe in February, maybe in March. I think Johnson & Johnson's pretty close. So I know other vaccines are around the corner. Has there been any talk about trying to move people up in the age range, in the at-risk age range, general population versus the various subcategories of essential workers. I know we've seen plenty of social media from state, local elected officials getting their shots. Some of it's well-meaning, some of it's a little braggadocious, but there are obviously people in that age range that we know, if they get it, as has been alluded to on this briefing, unless you get the antibodies and get the various cocktails, you don't stand a very good chance right now. And I think even Dr. Marsh sort of alluded to, we're getting to that population, but as I know some states are also pushing that population further to the top of the list of vaccine priorities. So is that something we've talked about? Is it something we're thinking about doing? I mean, we're moving very quickly, so maybe we'll get there quickly regardless, but someone could answer that for me, please. Thank you.
Well, Stephen, lots of people on the call can answer that, especially General Hoyer. But let me just make a run at it, from 80,000 feet. And here's all there is to it. When Dr. Birx came here, she was amazed with how focused we were on age. She was dead level focused on age. Absolutely, without any question, we got to be able to keep the continuity of government going. We got to keep, our hospitals open. We got to keep our acute care people going, our first responders. All of that network, we got to keep going, because if we don't have that going, then we're going to really fall down in lots of different areas. Okay. From the standpoint of getting this vaccine more and more directly to the general public, to the elderly, it is the number one thing that we're trying to do. The number one thing. Now, General Hoyer can speak about it, but my gracious sakes of living, we are working that as diligently as we possibly can to be able to achieve just that. The other thing is just this. When I came out and I said, hopefully, by mid-March, we will be way down the trail. Do you remember that? I mean, that's exactly what I said. And people said, oh, that'll never happen. No way. It'll be toward the end of the summer and all this kind of stuff. Hopefully by mid-March, we will be way down the trail. But General Hoyer, if you could step in and say a couple words, but I think that pretty well describes it.
Yes, sir, Governor. So, Steve, you are correct, and we are focused. And if you look at the phases, and you look particularly at phase 2A, what we've done is taken the 4 priorities that the governor gave us, plus the overarching strategic focus of age, and we're basically balancing. So, first focus is on age is related to that most vulnerable population in those congregate settings and nursing homes. And we hope to have that complete maybe as early as today. And then as we started into maintaining those services that are needed to keep our state open, we focused initially on that over age 50 population, and initially over age 60. And then we spent, as we told you, these 2 weeks of building the infrastructure that we still need with our regional clinics, our healthcare facilities, to be able to go after that age population across the general spectrum of West Virginia. So as the governor pointed out, we are focused on age as a top priority, because we know from the state's data that both our deaths and our hospitalizations, if we can address those age populations, we will have a significant impact. Thank you.
All right, thank you, Stephen. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. A few weeks ago, I got an email from Huntington, West Virginia, touting vitamin D as a good thing to do if you're trying to avoid the worst of coronavirus. That a lot of the patients who had died from coronavirus had a vitamin D deficiency. Dr. Fauci came out and said good things about vitamin D. I wanted to hear from the medical panel here if we should all be drinking a lot more milk or adding vitamin D to our supplement list until we get the vaccine more thoroughly through the state of West Virginia.
It's out of my pay grade, docs. It's up to y'all.
And why don't you take this one?
Oh, you want me? Okay. All right, Paul. That's a good question, and that's a very common vitamin that a lot of the physicians are giving across the spectrum, I guess. There's no clear data that's been written about us, but I think what's been happening is that a lot of the people that have been passing away from COVID-19 have been vitamin D deficient. It is an older population that has been passing away, especially in the nursing home population. We get vitamin D, of course, from our diet as well as from the sun. So I think that might be why you see that as a recommendation to take vitamin D. Vitamin D is also a mineral that can be used in our bodies for different things. But as far as I'm aware, there's no clear-cut evidence that vitamin D is protective for COVID-19. So that's as far as my knowledge for that goes. I don't know if Clay has read anything different, but that's where the vitamin D goes. But you can overtake vitamins too. We need to be cautious about that as well. So I would need to mention that vitamin D can cause, kidney stones and some other issues as well. So we don't want people to go out there and start popping vitamin D unnecessarily as well. But Clay, do you have anything to add about vitamin D and COVID-19?
No, thanks, Ayn. Paul, I think Ayn is completely correct that ultimately having low levels of vitamin D doesn't mean that that's what's predisposing you to having severe outcome issues with COVID. And there's no data, to my knowledge, that says that taking vitamin D protects you against severity of COVID. You should consult with your physician because low vitamin D levels can cause low calcium levels in the bloodstream, which can affect bone density in older people. So there's benefits of taking vitamin D, but I don't think there's any real reason to recommend people to augment their vitamin D other than getting out into the sun is healthy and drinking milk or whatever you like to keep the levels up. Other than that, I would use the input of your physician.
All right. Paul, now I said before, it's out of my pay grade, but my vitamin D level's not real high, not real great, but just for the doc's sake and everything, and your sake, Paul, I take a vitamin D tablet every day, and I feel pretty good. So anyway, I'm an advocate.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. For the last couple of press conferences, we've talked about the antibody treatment, the sort of treatments that the president, Rudy Giuliani, received. I've not heard anyone talk about what does it cost to receive that, and is the state doing anything to subsidize the cost of that? Is that something that's available to the average person, or is it restricted by cost? Thank you.
Secretary Crouch, you're going to have to do this, please, sir.
Yes. Thank you, Governor. The antibody treatment is available throughout the state. We had a call last week with the nursing home medical directors to make them aware of the ability to do this outside of the hospital. We're working with all of the long-term care facilities. This is a great approach to reducing deaths and reducing hospitalizations. There is data on this particular treatment, and there is a lot of information that shows this is very helpful early on, as quickly as possible after a positive test. Talk to your doctor. If it's a nursing home, they will immediately talk to the medical director. As the governor said earlier, time is of the essence in these treatments, and it's very important and very critical for folks to do this where appropriate to keep them out of the hospital. Thank you. The cost of that, let me add, I'm sorry, there was a cost question. That antibody has been provided to us through the federal government, so there is no cost right now for the antibody itself. So that antibody treatment must be arranged through your physician. There may be other costs associated with that, but not for the antibody itself.
All right, thank you, Charles. Next question from Katie Coyne with the Charleston Gazette-Mail.
Hey, Governor. I know we've gone over the phases a few times here in the last few days for testing, and I know we've been pretty clear that these aren't necessarily one after the other after the other. I'm wondering if you can clarify, or Secretary Crouch, Dr. Amjad, someone on the panel, when we talk about bringing vaccines into corrections facilities, we've only really talked so far about staffers. We're seeing more outbreaks or cases at least come up in these facilities. And at least with the holiday in the last few weeks, it seems testing hasn't been as frequent as it was before. When can we see vaccines get into our corrections facilities, and when should that be completed as well, knowing what we do about spread in these places? Thank you.
I'm going to defer to General Hoyer in just 1 second, but let me just say this too. As far as the successes in our corrections facilities, they've been phenomenal. I mean, I think we've lost 4 or 5 people in corrections all across the board. It is unbelievable how successful we have been to date. So, General, you go from there and everything, but we surely are factoring in all the things that we're doing.
Yes, sir, Governor. Katie, you're correct. We don't have vaccines available in numbers to be able to vaccinate inmate population. So what we have focused on is knowing from the DHHR epidemiology data that the bulk of the spread in those types of facilities come from the staff getting them in a community setting and then bringing them into the facility. So we will be focusing on the staff piece. Obviously, as we talked about in the previous discussion a minute ago, we've got to focus on our aged population in the state, because we know from the epidemiology data that we've got to get to that population, because they represent the most significant amount of our hospitalizations as well as the most significant amount of our deaths. Thank you.
All right, thank you, Katie. Governor, I'll turn it back to you.
Well, I don't really have many notes today. I'm tickled to death with how we've been able to get the vaccine out to our long-term care facilities, and especially, nursing homes and assisted living, because that's where for all practical purposes, half of the deaths are occurring. From the standpoint of, I'm really encouraged on how many doses are coming into West Virginia, and I'm encouraged on how fast we will be able to get this to people, that are out there that are, of our aged population and our general population, and how fast we'll be able to hopefully be getting that to them. One thing I want to say, before we go any further, is a fellow that has been the leader of the band, with our nursing homes, and has just been suffering through the COVID situation himself, is Larry Pack. And I think Larry's doing better, and I know it's been a tough go of it. I've tried to call him and everything, and he was probably having a really tough go when I was trying to call, but nevertheless, Larry, I'm glad you're doing better, and what a great man, and I know he's a delegate to be, and I surely wish Larry the very, very best. But I guess I just close by just saying this. Just please, 1,263 great West Virginians we've lost. Their families really do hear your prayers. And so join Kathy and I in that prayer always for all those. But in addition to that, there's a young family. There's a family of loved ones, mom and dad, and I can't recall, maybe a brother and a sister, but nevertheless, a mom and a dad and a fiance and a little baby to be, a great man, a hero in our country, Logan Young, we've lost. Please remember them too. And so that's really all I have today, but let's not only remember them, let's don't ever let them feel alone. So we're going to get through this, West Virginia. You just keep battling and hang in there, and whatever you do, for God's sakes, a living, don't listen to somebody tell you some hocus pocus bunch of junk about these vaccines, that you're going to grow another arm or you're going to start growing antlers. I mean, for crying out loud, you know, you've got to take the vaccine, West Virginia, because it will really save your life. Thank you so much.